things like soft peaches, things like scrambled eggs. You need to face me a little bit more to focus. Hi.
No. I've had trouble focusing, and my attention span has not been good.
So hold on one sec. I'm going to fix this tray because this is falling down and then creating issues with your arm. Is that okay? Is that better?
Fine.
Okay, so we've been working on the swallowing piece. So definitely the weakness on the left side of the face. So working on, like, what are the strategies you have to use during your eating to make sure that you're swallowing okay?
Do the tongue swoop. Marty and I have talked about this. It was a big deal at Birchhaven.
Still is. Still is a really big deal. Even what you're doing right now, you're pushing on your cheek. Why are you pushing on your cheek on the left?
To raise any residual food which continues to find refuge in between my cheek and my teeth.
Why is that happening?
Because I'm not chewing it up right.
Okay. There's something like, why are you an oromotor group? Why are we working on strengthening your facial muscles, your tongue muscle? Why are we doing all that?
Because it's important to learn how, at practice, swallowing to keep food out of your mouth.
Great. Yeah. And it's more...
So that anybody who talks to me will not see food in my mouth.
Well, I mean, that's true. But for me, it's, you're not trying to offend anybody by any means. It's for your safety. Because we don't walk around with food in our mouth after we're done eating. Typically what we do when we're eating is we move our tongue around and feel for food. And then we swallow it again, or spit it out, or whatever we do. We manage what's going on in here. Now that doesn't mean scraping off every little morsel still on your teeth. I mean, that just takes brushing your teeth, right? But the reason it's so important for you is because I don't want you to then, here comes this food, and you're going to breathe in, and you're going to choke on it. And you also just don't want residual food in your mouth.
Use liquids copiously to keep your mouth clean and free of undigested organic matter.
Okay.
Unswallowed organic matter.
So basically just get the food out of your mouth. So we're strengthening the left side of your face because the left side of your body, whole body, face to legs, right, has been affected by the stroke on the right side of your brain. So even the left side of your face is a little bit weaker, therefore isn't feeling as much. So you're not feeling the food. So that's why during our sessions, we're talking about it constantly. Get that tongue out, move the tongue around, use your liquids to help wash the food down, all that jazz. Right? So right now you are on what we call a mechanically advanced diet, or dysphagia 3 diet, or level 3 diet. So you're almost there at the, quote, regular diet. We've tried in many of our sessions to get fully upgraded. I don't think you're quite fully safe for it because of just paying attention to the food on the left when you're eating. I think your focus and attention in general is just making it difficult to focus on the food when you're eating it. So for me, that's the things like, remember we've been trying the graham cracker and peanut butter, the salad, that kind of stuff. It's just all of that is very dry, or it's just you have to chew so much that I just think we need a little bit more work before we can fully upgrade. We're almost there.
A little more work on the art of chewing and swallowing, the art of cleaning out your mouth,
Yes.
the art of making sure that your mouth is free of debris.
Yeah, and then I think also just during your meals, just focusing a little bit more on the food at hand, because I think that's what's an issue for you as well. Is just you're multitasking, which is what we do all the time, but then it's making it possible for you to not manage that food correctly. It'd be too hard for you. So we're not interested in any choking or any difficulty during meals. So that's why where we are, but we'll get there. Okay?
Do you have any questions?
Oh, she's doing great. Doing great.
Okay. Next piece. The speech is coming along. I think the speech is definitely better. What do you think?
I think I agree with you.
Mm-hmm.
My speech is coming along.
Yeah.
I think my speech is getting better.
Much better. Much better. What do you think, Marty? Do you think it's better? Great.
Absolutely. I mean, the way he's responding to you, like you ask him a question and then he answers.
Yeah.
That's typical.
Yeah. Yeah. Right.
Pauses and then answers.
I think since the stroke, people have a much more difficult time understanding what I'm saying. I'm not doing well speaking.
Well, you are, because that's what we're talking about, is that speech itself, the speech. So when you're saying your sounds and your words, people are understanding. It's just not maybe as much as it was before your stroke, right? And that's because of the weakness on the left of your mouth. So think of have you ever bit the side of your tongue?
I do it all the time.
Well, now you do, right? And so it's kind of like a lazy tongue, or some people even describe it as like a fat tongue. And it's just not touching the specific parts of your mouth to make precise, clear, targeted sounds. Keep that up. Okay.
Sorry.
No, that's okay. So that was your seatbelt. It was
Sorry.
It was saying you were trying to escape.
My seatbelt was telling me, you're trying to unattach me. Are you sure you want to do
it? Okay, so I think the speech is definitely getting better. The main session, the main things in our sessions we've been doing are the swallowing piece, the food, and then also the thinking. So yesterday we spent a good amount of time talking about thinking is kind of, remember I drew that picture for you? Actually, I still might have it. Remember that picture I drew? Of the hierarchy of thinking?
Yes, that's it.
It's very, 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 very generic. The bottom one, what does that bottom rung say? The bottom one, all the way down here.
Arousal.
Arousal.
Awake.
Awake. What's the next one say?
Thinking. There has to be some arousal.
Right, you have to be awake. Right?
You have to be conscious.
Yeah, sure. What does the next little rung say, or the little area?
Attention, focus.
Yeah. Yeah. And then we go all the way up the top, the highest level is executive function. So I was telling you that, and I believe this in general with him. And I think his thinking is very high level when it comes to, his memory's very good, being able to solve problems. I think a lot of it, though, is all impacted by the attention. And the attention is focusing or concentration. So, for instance, all this happens all the time. And we've had a very, very frank discussion. So nothing I'm saying to you is nothing I'm saying to Marty is anything we have not talked about. Is we'll be in the middle of a task and it'll be completely out of nowhere. He'll start talking about something or lose his focus and go somewhere else. Now he said that this is likely, that's kind of how he was before. Do you feel like that, like easily distracted?
Well, there would be times I'd be talking to him, and I'd have to ask, "Are you listening, or are you thinking of something else?"
Yeah.
Or
Yeah.
But when he's thinking of something, it's like very deeply thinking of something.
Yeah.
And so, you'd have to just really try to get his attention.
Yeah.
To get
Yeah.
his attention.
And so when I was talking to him about that yesterday, is that could very well be true. And some people that I see,
Maybe you had a stroke a long time ago.
no, not at all. But what happens is some people say, "Well, it's my ADD. I've never, even stroke or no stroke, injury or no injury." Some people go from thing to thing to thing to thing to thing. But what happens is they don't have a brain injury. They didn't have anything happen to their brain. So a lot of times their brains can compensate for it. They can deal with it. They can handle whatever it might be after a stroke, especially on the right side of the brain, which is where your stroke happened, right? The right side of the brain affecting the left side of your body.
I think, Maggie, my stroke was on the left side.
It was on the right side of your brain, which affects the left side of your body. That's just how the brain works. That's how the body and brain work. It's confusing sometimes. But just like the left side of your brain controls the right side of your body. So when someone has a stroke on the left side, the right side is affected. Okay? So go ahead.
Mine must have been on the right side.
It was indeed. So very common.